Good morning. My name is Marike Broekman. I'm a neurosurgeon at the Department of Neurosurgery in The Hague and Leiden, the Netherlands. And I'm very happy to be able to discuss with you today the ethics of AI in neurosurgery. So we all know that AI has great promise. In our everyday life, we notice that AI plays a more and more prominent role, but it also has a lot of potential for healthcare. But what is AI? It's broadly understood as any kind of artificial computational system that shows intelligent behavior. In other words, complex behavior that is conducive to reaching goals. Does it have great potential? I think yes. It can provide composite panoramic views of individuals' medical data. It can improve our decision making. It can reduce or even avoid errors as misdiagnosis or unnecessary procedures, and it can help us ordering and interpreting appropriate tests. And it can help recommend treatment, and who knows, in the near future, it can replace us in surgery. If we think about the ethics of AI, and I think it's very important to do so, while developing new algorithms, new uses for AI, I think it's very good to consider the ethical implications. There are actually three pillars that need reflection. The first is collection and privacy. So when you collect data, how are you going to do it in an ethically sound manner? Ownership and storage. Data will be stored, but who owns the data? And use and implementation. Eventually, data will be used and implemented. How are we going to do that in an ethically sound manner? So for collection and privacy, one of the most important things is that we or our patients agree to sharing all their data. How can we do that? Well, as we all know, every now and then you need a new update for your phone, your computer, or whatever, and you just click yes, 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 because you have 27 pages of things to read. Perhaps that's not the best way. What the best way is, we don't know exactly, but it is important that we are aware that we're sharing our data. Our patients should be aware that they're sharing very sensitive information about themselves. So one of the things for AI, if we wanted to be able to fulfill the promise, we should be aware that that there is informed consent for collection and use of the data. It would be one of the risks if we don't do this is that all our data is collected, or the patient's data is collected, and that it's used for things that it wasn't intended for. People might be denied insurance because, well, your data suggests such and such a thing. So ultimately, we want to prevent that. So therefore, it's very important to set clear delineations and discuss best practice. How should we inform our patients? What should informed consent look like? And how we're going to use our patients' data in an ethically sound manner. So AI holds great promise. You don't only want to collect data, but you also want to do something with it. So for that, there's always, it needs to be, stored somewhere, and people will claim ownership. Who owns the data? So I agreed to Apple that they can have all my information regarding my phone logs, my GPS data, the number of steps I take during the day, etc., etc. I clicked yes, 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 yes. But our patients, is it their data, or is it if we use their data in hospital, does the hospital own their data, or is it the doctor that owns the data of the patients? Well, these things are not clear yet, and I think that research needs to be done about this before we actually use AI to the extent that we think it will be used in a couple of years. So we need to think about who owns the data. And if so, for medical records, usually have a specific time period for which it's stored. Does the same hold true for other types of data? If we collect a patient's GPS data, will that be stored for 20 years or until they pass away? Or, well, questions like that need to be answered when we want to use AI in an ethically sound manner. So in AI, you collect data, you store data, process data, and you use it. And that gives rise to different ethical challenges, because you don't only collect data, but you can use it to manipulate behavior, to suggest, well, I see that you haven't been walking that far. Is it because you're in pain? Or you could try to do something else. And this manipulation, even if you don't want it, you might run the risk of being a bit paternalistic, that you sort of easily decide, okay, we should do this intervention, etc. Sometimes it's without the intent to do so. And it can be as simple as, you want to reach your 10,000 steps a day. If you don't, well, you're encouraged by your phone to do so. But it could also give rise to different types of problems. If you collect data, it will be for a specific cause. It will be, for instance, you want to collect data, see in how much pain patients are after surgery. They can report it, or you can measure it in different ways. But can you use it for something else too? Your data is about heart rate is collected so that if it's like irregular, your smartwatch will actually indicate that it's irregular and you should consult your doctor or whatever. But that information can be used for other things as well. We should make sure that patients consent to that, or should they consent to all these things? So questions like this are more and more important. And if we want to use algorithms in clinic, we should make sure that we should make sure that there's scientific validity. We should make sure that we've tested it, and how are we going to do it in an ethically sound manner? This brings me to the second point that we need to think about when discussing use and implementation of AI in clinic: opacity and behavior. It's often not very clear why a specific recommendation is given. It's not very clear how the algorithm works. That's one of the things that defines AI. You put some things in and then pop, black box, and this is the answer. And it's officially recommended that if you use like a medical tool, you should sort of know how it works and how it comes to that recommendation or comes to that suggestion. Well, that's a challenge for AI. And well, people are working around trying to find ways to work around that now, but that opacity is a challenge for AI in medicine. We should be aware that there can be bias in decision systems. There can be a learned bias, there can be a cognitive bias, and there can be statistical biases. So we need to be aware of that. Last, robotic surgery does not play a very big role today in neurosurgery, but that could change. We should, and the more algorithms take over, and the more important robotic surgery, for instance, becomes, we need to think about autonomy and responsibility. What happens if the a complication occurs during robotic surgery, who is actually to blame? Is it the robot? Is it the surgeon? Is it the manufacturer, etc.? This is a very extreme example, but it could be that there are, these flaws in the algorithm. Is it the programmer? Is it the producer? Well, we don't know who's actually responsible. So this will be a challenge and a topic of further studies. Because indeed, can we teach robots right from wrong? Some would say, of course, we're humans, we can program them. We can program them to be even more ethical than humans. Because humans always, when pressed, they will give the socially accepted answer, but they might act differently when pressed. But robots will always do what you program them to do. So some say, of course we can train them. We can even program them. Others say, well, that will be a challenge. How to make decisions, especially for situations that you can't think of in advance. So there will be a challenge. So it will be interesting to follow the debate about responsibility and rights of robots or other autonomous systems. Can they be responsible? Is there a shared responsibility? Because if there is an error then, well, do we share responsibility? Like I said, if the decisions or actions based on AI, they're usually the result of numerous interactions. Interaction of designers, developers, users, software, hardware, etc. And if we distributed this agency, did we distribute responsibility as well? Can a robot or an algorithm be a moral agent? Can they have rights as well? Well, questions like that need to be answered. And I think therefore it's crucial to invest in ethics research while developing new algorithms for surgery. The 3 laws of robotics were formulated decades ago. And I think it's very good to keep that in mind when thinking about responsibility. The first law is that a robot shall not harm a human through action or inaction. The second law is that a robot shall obey any instruction given to it by a human. And the third law is that a robot shall avoid actions or situations that could cause it to come to harm itself. So these 3 laws might be crucial when thinking about, can we teach ethics to robots? I mentioned numerous challenges for healthcare, numerous ethical challenges that we need to reflect upon over the next decade. AI will change the face of medicine. Our work will change, but it might not only reduce our workloads, it might not only find like cures for cancer, for instance, but it might allow us to restore the precious and time-honored connection and trust. If, for instance, algorithms take over, they'll do a lot of the diagnosis and management for us. Humans can do things that humans are good at. They can come together, they can connect. We can invest in other human beings, and that human connection, that's something that will be hard to replace. And this is a chance for us, that we don't have to waste our time doing things that can be automated, but that we can do things that only humans are good at. So it might actually be a chance for medicine to invest in AI. Well, in conclusion, I believe that AI has great potential for society, for medicine and neurosurgery as well. There are many ethical challenges, and these are related to the collection and privacy. How do you do informed consent for this, for primary use, for secondary use, etc., etc. There are challenges related to storage and ownership. How do you store the data in a safe manner? Who's the owner of the data? Is it the patient? Is it the doctor? Is it the software manufacturer? Who owns the data? And if you use the data to manipulate behavior, for instance, who's responsible if something goes wrong? Can a robot be sued? Can a producer of a robot or the programmer, or is it the doctor who will remain responsible for the actions of a robot? I think AI gives rise to many challenges, but also chances. For instance, a chance to put the human back into medicine, that we can invest in the human connection in care. To achieve this, to make sure that AI can reach its full potential, I think it's not only necessary to invest in the technical aspects of AI, but also in ethics research. And with that, I would like to thank you all for your attention. And I'm sure there are many questions, and please contact me either in Leiden or The Hague. I'm happy to discuss with you ethics related to neurosurgery and AI in neurosurgery. And again, thank you so much. Bye.